Hello, my name is Tristan, and this is the subcutaneous injection skills video. First thing I want to make sure is that I have all my supplies, which is the heparin, the medication, the heparin, gauze, alcohol swabs, my 1 inch, a 25 by 5/8 needle, hand sanitizer, my needle receptacle, which is a water bottle for the purpose of the video because I don't have a receptacle, my gloves, and my patient. The next thing I'm gonna do is I'm gonna go ahead and verify the provider's orders in the EHR, and then I want to, next thing is to verify the patient's rights, which is the right patient, the right drug, the right dose, the right route, the right time, and the right documentation. Once that's done, I'm going to go ahead and I'm going to compare in the EHR on the MAR the provider's orders against the medication that we have here. And the provider's order says to administer 1,000 units of heparin 1 time a day starting now. And our vial says we have heparin, which is 10,000 units, in a 10 milliliter vial. And we're going to calculate that out, which ends up comes to 1 milliliter, which is 1,000 units of heparin. Now verification is done. I'm going to go ahead and I'm going to enter into the patient's room. The first thing I'm going to do is I'm going to open the door, close the door, use proper hand hygiene, hand sanitizer, and introduce myself using aided. Hi, Mr. Ramirez. My name is Tristan. I'm going to be your nurse today. We're here to do the subcutaneous injection, and this is only going to take a few moments. And during this whole process, if you have any questions, please let me know. Can you please tell me your first and last name and your date of birth? Great, thank you. He provided the, I got the 2 patient identifiers. The next thing I want to do is ask, do you have any allergies to food, medications, or environmental substances? No? Great, thank you. Okay, so the next thing we're going to do is proceed in preparing the medication. So what I'm going to do is use proper hand hygiene. I'm going to go ahead and I'm going to put my gloves on. So Mr. Ramirez, what we're going to be using for the medication is heparin, and what heparin is, it's an injection that is used for blood thinning as an anticoagulant to prevent blood clots from bruising in or for forming into your blood vessels. Some common side effects can be easy bruising or increased bleeding time if you get cut or scraped. Some adverse effects could be black or tarry stools or blood in your vomit. Now, if these are more severe, and so if any of these do happen or you do experience any of these, please let me know immediately as soon as they occur. As with most injections, you might feel a slight burning or stinging at the point at the site when we do the injection, but that should be resolved rather quickly. Okay, now I'm going to go ahead and I'm going to draw this up. So first thing I'm going to do, I'm using alcohol pads just to let you know that I've already been used because I'm all out of them. Okay, so what I would do is I would take off the alcohol pad, I would make sure I clean the top off of my vial, allow that to dry, and while that's drying, I'm going to go ahead and get my 1 milliliter by 25 gauge by 5/8 needle, and while I keep the top on, I'm going to go ahead and I'm going to pull up air at 1 milliliter of air, as you can see. Next, I'm going to go ahead and take the top off. Our vial is done drying. I'm going to go ahead and I'm going to insert the needle, push the plunger down, put the 1 milliliter air into the vial, invert the vial, and then I'm going to go ahead and pull the plunger back and drawing up 1 milliliter of heparin. Okay, and if there's any bubbles, I'm going to go ahead and tap the needle to make sure that there's not. Okay. And I'm gonna use a one-handed swoop technique. Put the cap back on. And as you can see, I have 1 milliliter of heparin. Okay, so now since that is done, the next thing I'm going to do is I'm going to go ahead and I'm going to choose the site of where we're going to go ahead and put the injection. There's 3 places that I would that you can inject, and that would be the abdomen, the back of the arm, or the upper thigh. But for this video, what we're going to do is just going to perform on the abdomen, which I'm going to go down from the ribs, go underneath the ribs, and 2 inches away from the belly button. The next thing I'm going to do after I chose the site, I'm going to go ahead and check for any type of inflammation, bruising, or blemishes, wounds, etc. Okay, so the skin looks good. The next thing I want to do is palpate the skin to make sure that there's no tenderness of the patient. Okay, and now since we notice that there is the site has a great skin integrity, the next thing I'm going to do is I'm going to go ahead and I'm going to pinch the skin. I want to get at least a 1/2 inch skin fold, and I can use my needle to go ahead and check to make sure I have the 1/2 inch skin fold. And since everything is good, I'm going to go ahead and put my needle back down. The next thing I want to do is clean my site. And once again, I don't have another alcohol pad, so this is a used alcohol pad, but for the purpose of the video, I'm going to use it. So if this was a clean one, I go ahead and I would clean my site in a circular motion, about 5 centimeters out. Okay. And while that's drying, I'm not going to go ahead and wave it. I'm not going to blow on it or anything like that. Just allow this to dry. While that's drying, I'm going to go ahead and I'm going to take my fingers and I'm going to use just my thumb and my 2 fingers and pick up my needle. I'm going to go ahead and I'm going to pick up my needle using 2 fingers, kind of like a dart, okay? And I'm going to go ahead and I'm going to take the top off, okay? And since this is heparin, I'm going to go ahead and continue to, I'm going to use the pinch the skin, 1/2 inch skin fold, okay? And then I'm going to make sure I'm going from at a 45 inch in a 45 degree to a 90 degree angle, and go ahead and inject the needle into the skin. And while I'm going to push down the plunger, I'm going to make sure I'm going to insert the medication at 30 seconds. So I'm going to take 30 seconds to go ahead and insert the medication. Okay. Insert it slowly for 30 seconds. That's how I want to say it. Okay, and so for the purpose of the video, I have inserted it. It's been 30 seconds, so I'm going to go ahead and take that out. And then I'm just going to go ahead and drop the needle into the needle receptacle without the cap on. I'm going to take the gauze, put the gauze on top, and put the cap into the receptacle as well. I'm not going to push on the gauze. I'm not going to rub the gauze as well. I'm going to check to see if there's bleeding. If there's still bleeding, we're going to go ahead and air dry it. But the bleeding has stopped. Mr. Ramirez, would you like a Band-Aid? He says no. Great. So that's good there. The next thing I'm going to do, I want to go ahead and clean up my site. Clean my site up. Okay, make sure I put all my stuff away into the receptacle. I have my needle put into the needle receptacle. Put my medication away. I'm going to go ahead and take my gloves off. I'm going to use hand hygiene. I'm going to make sure my patient's put back into a comfortable position. Then I'm going to give him the call light, check to see if there's any side effects or any adverse effects. The patient is good, and ask if he has any questions. Next thing I'm going to go ahead and do is document in the EHR what happened, what transpired in here, and the medication that was provided. And I'm going to make sure I put in the location of where I put on the injection site. Then I'm going to make sure I list the 6 patients' rights, which is the right patient, the right drug, the right dose, the right route, the right time, the right documentation. Once all that is done, I'm going to go back into the room just one more time, check with the patient to make sure there's no side effects or adverse effects. asked if he, one more time if there's any questions or if he needs anything. Thank the patient for allowing me to come in and to administer the medication, and hand hygiene once again, and then leave out the room. And that's it. Thank you.